Okay. Good morning, everyone. I'm Robin Shapiro. I'm the board chair of Washoe Health Advocate X, and I'm delighted that you've been able to join us again today for a community conversation. It's been quite a while since we last met, and there's a lot to update you on COVID-19. We have our wonderful, amazing board member, Dr. Dale Reisner, who is medical director at Swedish Health Services, OBGYN, Quality and Safety, who will be kicking off. And then we are delighted to welcome to our community Emma Payne, who's CEO of the Grief Coach, and she'll tell you a little bit more about that. We are talking today about navigating grief and COVID-19. But first, Dale, do you want to kick us off?
Sure. So welcome. Some of what I say is not going to be very hopeful. Some of it is going to be depressing. But I think that the group who attends these meetings is the perfect audience to have a balance between reality and hope for the future when it comes to discussing COVID. So the part that's not very encouraging is that we in the world have over 54 million cases of COVID and 1.3 million deaths. And so when we look specifically at the United States, we're over, and the last few days, I just kept adjusting the numbers because they just keep going up and up. We're over 10 million, almost 11 million cases of COVID-19 with close to 250,000 people who died from it. And this is from COVID specifically, but we know that there are other deaths that have resulted from people not getting care, and those are not captured in any of these statistics. In the United States, we have two real interesting contrasts. The state of Texas is now the highest number of cases, over 1 million cases in Texas, with about 20,000 deaths. And that's compared to New York, which of course, was shortly after Washington State with a big swarm of cases where it was 500,000 cases, but 34,000 deaths. So the death rate's really different depending on where you live, and there may actually be a difference between the types of coronavirus that the West Coast got the Chinese version, and the East Coast may have received more of a version that came over from Europe that had some mutations that may have made it more deadly. Hard to know for sure. And I'll just highlight that we have now seen, not a ton, but several reported cases across the country of confirmed repeat illnesses. Some were milder second time around, some were more severe. And they were different strains. That's why we know there were actually two separate infections. And about 3 months apart was the shortest period of time. So it really does raise the question about the wild virus and whether we have very long immunity after we actually have confirmed a case and a resolution of that case. So that speaks to the vaccine issue, and I'm going to talk about that in just a second. But in Washington State, because many of you on the call may be from Washington State, we are up to 133, almost 134,000 cases and 2638 deaths as of yesterday afternoon. Yesterday, we had the highest volume of cases that we've ever had with COVID-19. We had 2,000 cases in one day. And we are—
So that's new cases?
New cases.
In one day?
In one day.
Not total cases?
Not total cases. And I can just speak to that hospital admissions have quadrupled in the last 2 weeks. So that's in our state. That's in the state of Washington. So I just want us to— that's a background setting really that speaks to the concerns that many people have about where we are now. It's winter, it's holiday season, and what we can do to protect ourselves. So I do want to talk a little bit about the vaccine, and then I want to end on a couple of minutes of talking about prevention. So the vaccine, obviously, that would be in prevention. We now have two major pharmaceutical companies in the U.S., Pfizer and Moderna, who have reported efficacy. So over 90% efficacy of the virus in protecting against COVID-19. Moderna is not quite as far along in their final assessment, but is saying like what they have so far is 94%. And so that is super encouraging. Now, those are vaccinations that require 2 shots a month apart, basically. And we will require some careful distribution. So in the United States, their population estimate from 2019, we don't have the current population assessment, as you know, was something like 328 million. And so even with multiple vaccinations coming out with different companies, we're not coming anywhere close to being able to vaccinate even 80% of the population. So everywhere right now, it's state-based. And the state of Washington, the Department of Health and the public health agencies have already put together a whole distribution plan. And I know that this is happening nationally with the new leadership group that will be starting the 20th of January. So there's hope for that. I think that's really hopeful that we will have a countrywide approach to who gets the vaccine, so that it's not based on who can pay for it. It's based on those who are the highest risk. And I'll tell you right now, it's going to be the frontline healthcare providers. We are going to be running out of healthcare providers pretty soon. So those guys in the state of Washington, at least, are number one, and they're not going to be me because I'm not at the bedside. They're going to be people who are at the bedside. And so we'll, I know there's a couple questions popping up. I'll address those probably at the end. So we'll be really looking at how the vaccine gets distributed with equity in mind and with the highest risk populations in mind. And that we still, with the vaccinations, are going to need to do some of the things we've been doing all along, right? So I do want to get into that, and to start with, we've already talked about the University of Washington-based research group, IMHE, and their predictive modeling. It's been highlighted recently in a number of different general publications, including the Nature magazine. They have been quite accurate so far in the number of cases that they predicted. And I want you to think about this. So by 12/31, the end of this year, if we continue with what we're doing right now, there will be, in the United States, 1.9 million deaths from COVID.
Deaths? 1.9 million deaths?
Uh-huh. If we
Oh, wow, that's
if we do universal masking, we can reduce that by over 130,000 deaths. So we have to really look at, remember, we're at 1.3 million deaths right now we're at 250,000 deaths in the United States right now. So we really need to be able to be careful about what we're doing. Our huge surge in cases is something we have to take really seriously. And if you look at death rate by March, middle of March, end of March, if we continue to do what we're doing currently versus universal masking. Universal masking is defined as 90%, 90% of the population masking and of course doing hand washing and distancing at the same time. We could save over 500,000 lives.
So can I ask you to go back over that? Because I don't think I heard you correctly. So
that would be total deaths, right? Not new deaths, but total from COVID-19.
At the end of this year, in just another month and a half, it would be how many deaths? I think you said 1.9 million deaths, but that sounds like it's too many.
We are, so this is not you, this is world, I think.
Okay. That would make more sense.
Because we're at 1.3. Okay. This is in the world. Yes, not Washington State.
Okay. And not US. Okay.
Yeah.
Okay.
Yeah. So 500,000 deaths prevented if we can do universal masking. And if we loosen up, then we're going to be increasing by about that same number of cases.
So can you go back, and we're at, for the United States,
right?
We're at 250,000 deaths about right now.
Correct.
And that the IMHE predicts that if we continue where we are, how many deaths in the US do they predict we would be at by the end of the year? Do they have that, or sorry?
I don't. They do have that. I didn't write that down. Yeah.
Okay, gotcha.
Yeah, they do.
Okay.
The percentage of deaths per cases in the US is running, and this is variable in different populations, as I called out by both comparing New York and Texas. But the overall is about 1.5% death rate out of the cases, the confirmed cases in the United States. And different countries have different percentages, but in general, it's running around 1%, between 1% and 2% for most populations. Obviously, the more advanced age populations have higher death rates than the younger. So the importance of this modeling is that it has shown to be pretty accurate so far. And so what we really need to do is think about what we can do to minimize our risk. And one of the things that we can do is universal masking ourselves. So masking will help us if we're sick from passing it on to somebody else if we don't know it, that we've got it. And it will definitely help us from getting the virus. And I think a few months ago, I did a little mask demo. And one of the things I see all the time is because stores are requiring masks, many of them, and enforcing it, people are walking in with a mask on and then sliding it down. They're putting it under their chin. Their nose is hanging out. Don't get near that person. First of all, that's not going to protect you. It's, if you don't wear glasses or have face covering, you can get it through your eyes, through any mucous membrane. And you do not want to be anywhere close to somebody who is not wearing their mask properly. So that's one thing you can do. And please share that information, because I don't think people really understand how important it is. It's not just what we breathe out of our mouth. If there's been an exposure, the symptoms may not show up for 10 full days. And so that 2 weeks of quarantine is really a valid number. So if you get exposed to somebody, do not believe that it's fine to just go running around doing your own business. That's not okay.
So that's a little bit of a change too, because previously I think we had heard that it was about 6 days-ish And so that sounds like a little bit longer period of time.
Typically it's that week in the middle, sort of. So 3 days after exposure is the most common time. So if you look at what's common, and yes, and so, you know, when you think about it, okay, if you get symptoms starting around 3 days, a week would make it be about 10 days. So we are considering people who have had the infection to not be transmitting by, if it's a mild to moderate infection, by 10 days, 10 to 14 days. So you've been around somebody you know was sick with COVID 2 weeks ago, be around them now, because, you know, be careful, because there are a few people that, especially immunosuppressed, that seem to be not resolving. But, you know, that's the person that probably has antibodies and for a little while, but not necessarily for a long time. So the things the other thing that you can do, and I know there's lots of people and there may be some people on this call that are not big into vaccinations, but get your flu vaccine if you haven't had it already. The last thing we need to do is to be overwhelming our hospitals with the flu when we have a vaccine available. Probably you're safer with some of the things you're doing in terms of social distancing and masking and all of those things, and staying close to family members and not getting in close spaces. The other thing that is really consistent, so there's a study that came out of combination of Stanford and Northwestern universities, and they did, this is fascinating and it's a little creepy, but they looked at cell phone geography in 98 million people between March and May. Okay, cell phone data on where we were between March and May, 98 million people in the United States. And what they saw was the places you got sick from full and limited service restaurants, bars, gyms, and religious gatherings that are enclosed. So those are the places when it looks like holiday season, end of the year, cold weather, and we're tempted to do something just a little bit more than what we've been doing, please don't, and pass that information around, because those things have shown up over and over again. And contact tracing is lousy in our country. There's only a few countries that have done it well. Australia is one, I think South Korea is one, where they really, you know, contact 10 people, they can kind of figure out. Right now we are at a total loss, and in fact, so is much of Europe, as to where this is coming from, other than this type of information. So
and Dale, before we move on to Emma, we do have a question about those vaccine distribution plans, and how will people from different states figure out, you know, who qualifies, who doesn't? How does the information flow go?
Yeah. So I would check with your Department of Health. Every state has a Department of Health texas.gov or you know, something along that line, and see if there's anything published already about the plans. I have so much more faith in the fact that these vaccines will be distributed fairly with the onset of a federal government that is putting faith back into the CDC, our public health officials, and letting them be the experts on how to disperse this. So
we'll see more of the CDC kind of is what you think will happen.
Yes, and I think strong public health in the state of Washington, our public health officer, Kathy Lofi, is amazing, and she has been all along, you know, trying to emphasize the things that are population-based safety. And that's really how we're going to have to look at it.
Great.
Yeah.
So any kind of last thoughts before we
I want to move on to Emma's talk, and if there's anything at the end, great. But yeah, I'm really anxious to hear what Emma has to share with us.
Okay, welcome, Emma.
Hi, everybody. Thanks for having me. I like the line that you began with there, Dale, about it's unfortunately we have to begin with some depressing news and data, but then we'll move on. So I'm really pleased to be here and to talk about the grief work that I do and that so many of my colleagues are doing, and things that we really can do to help each other right now. So to Dale's point about 250,000 COVID deaths in the US, that translates, according to the sort of CDC metric, about 9 people grieving every death. That puts us over 2 million Americans grieving COVID deaths. The CDC's report that came out in July let us know that unfortunately, pretty much all of our causes of death are on the increase. We're seeing more cardiac events, more suicides, overdoses. So if we look at the number of Americans newly bereaved in 2020, the number is about 10 million, probably. My company, Grief Coach, back in March, we started doing work with Virginia Mason's Grief Services team to look at what are the particular things that people are feeling who have lost someone to COVID or who have lost someone to another cause of death during COVID. And there are things like, of course, being so sad that we couldn't be with our loved ones at the end. Frustration, couldn't get access to testing, guilt. What if I brought this virus home and that's why my mom died? A lack of closure, funerals couldn't happen, anger. I mean, a lot of deaths bring with them some anger, and that's normal and natural. But with COVID deaths, if you just lost someone and then you see a bunch of people having a party next door without their masks on, it's easy to find a landing place for that anger, let's say. And for people who lost someone in other ways during the pandemic, a lot of the same things apply. Sadness that they couldn't be with the loved one, couldn't sit at the bedside, angry with the government, with friends and family, with themselves. You might be angry, upset that you now can't get the support that you need because all the therapists are overloaded and you can't hug your neighbors. And the big one, of course, is isolation. So whether you lost someone to COVID or lost someone another way during this pandemic, you are grieving alone in a way that really we've never experienced before. And I think one thing that's maybe just helpful to know is that means that most of our 10 million grieving people are experiencing something that in grief world we would call complicated grief. So normally out of order losses, loss of a child, or traumatic deaths would be associated with this idea of complicated grief, where there's anger and guilt and stigma and shame and so on. Unfortunately, I feel as though what's happening here with the pandemic and people being isolated is that a great majority of ours are not only grieving, but we're having this complicated grief experience, and that can make things more difficult. And the lack of access to the traditional types of bereavement care that we'd be used to is just exacerbating it more. For me and for other people that have been doing grief work before the pandemic, we already thought that we needed more bereavement care in the US and that there was more that we could do to make sure that people didn't need to grieve alone. But now I think we're just seeing it in this way that a year ago we couldn't have imagined. So I believe that bereavement care is in fact healthcare. This is not just about cheering people up after something sad happens. We have decades and decades of data about the things that can happen after a death. So, there's data about increased substance use, particularly if you've lost someone to addiction, for example, increased suicidal ideation if you've lost someone to suicide, increased anxiety and depression for all kinds of losses. People that lose a child, we see even decreased life expectancy. Mm. So my belief is that bereavement care is healthcare. So this is not about, hey, what can we all do to help each other through grief? This is actually an opportunity. It's a window to think about our health, our emotional health, how that translates, and just, yeah, like the
Emma, is there a way to, and are there like aggregate stats on what percentage of people get through their grief effectively? Is there like a way to measure that?
yeah, for sure. There's like now the whole post-traumatic, what is it, growth syndrome. The idea that when a person is supported in their grief, we can in fact grow and be stronger, and the whole kind of the sky is bluer is possible. There's all kinds of data about how a difficult thing can make us stronger, more appreciative, value things differently. And that's probably the global experiment that we're now in the middle of, right?
Yeah.
What could we actually all grow and learn in the way that we know that people can grow and learn after a death or a loss or during their grief. But we also know, unfortunately, that most people do not get the support that they need after a death. And that's where we have all of these other repercussions, including illness and anxiety and depression and so on. So, and before I try to transition into better news, I think just even as Robin and I were chatting before the call started, and she was sharing about needing to cancel holidays with her mom. So if we've got 10 million people having a complicated grief experience because of a death, how many of us are grieving the other very real things that are going on right now? Missed visits with children and grandchildren, canceled vacations. So many people have lost their jobs. Just a loss of freedom to go out and do the things that you want to do, and time with your friends, relationship stresses. So I just want to acknowledge that grief does not belong just to death, and that we have a lot of people experiencing a lot of sadness, and those sadnesses are real as well. So that's the bad part.
Yeah.
It's just of a scale that is it's just difficult to I'm finding it difficult to wrap my mind around just the scale of it. So that's the tough part. But what I thought I would do next is talk about the work that I do and others in this phone call here do in grief support, and what we actually know, because guess what? Human beings are resilient. We do actually come equipped to deal with sadness, to deal with pain and difficulties. We have the emotional range to have a bunch of different emotions, and it's okay. I think that when it comes to grief and loss, long before the pandemic, in our culture, we'd just become so distant and separated from grief and loss that we do a lot of the, okay, buck up, I'm fine, everyone cheer up. But it's okay to be sad. And in fact, so much learning can come there. So here we are. My feeling is that as we see everybody from Rolling Stone to the New York Times to everyone talking about grief, we are at least elevating a discussion that's probably long overdue to be elevated. And so what do we learn here as we're all experiencing this grief? And the first thing is that we shouldn't be embarrassed that we don't really know what to do. When people tell me every single day, oh my gosh, I don't know what to say. I don't know, it's really scary. I've never known this to happen before. I can't think. And so we stay away from each other, right? We send a Facebook post or send some flowers, and that's the end of it. Even though we know deep down that's not really what's in our hearts. And there's no shame in that. We're not taught it anymore. One grief coach I was talking to was telling me that, we have fire procedures and we know what to do if our plane starts to go down or if our office building catches on fire. We're trained for what to do in a very, very unlikely situation, but we are not trained about what to do in an absolutely 100% inevitable situation, which is that we lose someone or someone we love loses someone. We're just learning, if nothing else, maybe COVID gives us a chance to just like flex that muscle and do that bit of learning that we might not have done before about what do we do? What can we do that's helpful when someone dies? So I was going to start with just a couple of, I was going to share a couple of stories from my subscribers. So I run a company that provides grief support, and we support not only the griever, but we also support their friends and family that want to help and might not know how. So here's a couple of examples that I just think are, can maybe help us feel hopeful.
Good, we need that.
So these are both pre-pandemic stories. So one is of a new young mom, Kristen, whose baby was stillborn. And she signed up, so Grief Coach is a text messaging service. So Kristen purchased a Grief Coach subscription for herself. And what she can do is she can also add in friends and family who want to help. So when I met Kristen, she was devastated, of course, because her baby had died. But I always now describe her as preoccupied with how isolated she was feeling. Example, my husband won't even mention the baby and he's drinking too much. My best friend flew across the country to be with me, but she left yesterday because she said, quote, "I don't know how to be with you when you're like this." So the isolation, heartbreak, and the isolation that comes along with grief predates COVID, I guess is my point, right? It's always been for many of us an isolating experience because people don't know what to do. Like that husband and that best friend, that's not what is in their hearts. It's not what they want to do. So she shared with me that she started getting text messages with specific suggestions all year about how to deal with the loss of her baby. But the husband and the best friend are getting messages too. And on the second day, I heard directly from the friend. So this is the friend who got on the plane and said, I don't know how to be with you. Back when you could get on planes and visit people when they had babies. And she came to us and she said, "Thank you so much for understanding. This is hard for me too. I don't know what to do."
Yeah.
And it was so, it just struck me. I thought, wow, and I hear this every single day. Like the other story I was going to share was a woman, Rachel, whose mom died. So she said, "I love these texts you're sending. It's helping me understand and think differently about my mom's death. But I really, really want to thank you for the ones you're sending my husband because he's being more patient with me now." And then the husband's thankful too, right? No one's asking him to go and sit in a support group for hours or to read whole textbooks, but he does want to be there for his wife. He wants to be a support.
So do you give like suggested language to use? Yeah.
And tips and date reminders, and this would have been the mom's birthday and things like that. So I chose those two stories because to me they're hopeful because we actually have it all inside ourselves to help, right? There aren't enough therapists and support groups. There weren't even before COVID, but a human intervention works. We all can, in fact, learn, flex that muscle and learn just things that are helpful when someone dies. I don't know, the stories just sort of prove to me that, that we're good. No, we don't actually think the Facebook post is enough, right? We're just not sure. We're just not sure what to do.
Yeah. And I'm assuming that you're going to give us a few like concrete tips that we can take away today also.
Excellent segue.
Yeah.
So here is the single tip, bar none, that everyone resonates with the most, that our grievers are most grateful for, that people say like 99 times out of 100 offers this healing, wonderful thing. Talk about the person. Say the name of the person who died, almost as if they hadn't even died. I'm getting a thumbs up from Cynthia. Thanks, Cynthia. It's funny how counterintuitive this seems to people, but I hear all the time, "Oh, I don't want to mention them. I don't want to make them cry." Or, you know, like teenage grievers who say that no one, their friends, completely stop mentioning their dad, period, for example, right? Talk about them. Use their name, ask questions about them. Remember that time that we were out skiing on, right? Just flex the muscle of feeling comfortable saying the person's name. If a photo pops up on your phone, send it to them. Say, "Oh my gosh, this was hilarious that time that your mom was carpooling us to," you know, the simple talking about the person is so healing for the griever, because they're like, this person still matters. They matter not just to me, but to other people. They're not gone forever. They're in our memories. And it's an opportunity for them to then talk about the person that they've
Yeah,
lost.
we had somebody in the chat also recommend to ask to see a picture
Mm-hmm.
and to also say the word die and death and not the word loss.
Right. You can say that they've died. Yeah.
Mm-hmm.
Yeah, I mean, one of my other suggestions is definitely around avoiding the platitudes. Nobody needs to hear, oh, they're in a better place, or at least they're not suffering anymore, or oh, you've got other children, or no, someone has died and it's really sad, and your friend gets to be sad about it, and that's okay.
Mm-hmm.
And instead of, oh, well, I'm worried that if I say the wrong thing, they'll start crying. If you have someone who's comfortable crying with you, know that you are giving them the greatest gift. Those tears, as they come out, are healing, they're processing. Don't be afraid of the tears. Lead with love rather than fear, and don't be so concerned about the specifics, I guess. Just, they'll, at the end, they're not gonna remember exactly what you said anyway. They'll just know that you were there, or that you stayed away because you were freaked out.
Yeah, yeah.
So,
So we do have a question from Lisa Casaro. Is the lack of being able to grieve in part due to our marginalization of death and the death experience in our society at large?
well, we're definitely more and more separated from death, right? People are not dying at home. We're not part of the experience on the way through, so that we could be grieving together even before the last breath has happened. So yes, I think partly the marginalization, the separate nature of the experiences is part of it. But we also, here in North America, live in a world where we're always just supposed to be happy or something. Like, we're also just not that comfortable acknowledging, or at least pre-pandemic. Now it's maybe changing. I hear people now, every meeting I'm in, truly asking the other person, how are you really? What's happening?
Yeah, there is like this authenticity.
There's an authenticity happening, which is pretty amazing.
Yeah, we have a comment from Vanessa Laughlin at Bannister Advisors. Such wonderful guidance. This type of continuing bonds grief therapy is so standard in other cultures like Latino, Japanese, but is not considered very normal in dominant white American culture.
Yeah, I watched there's a really funny documentary now, I can't remember, Gabriel Byrne, he's the Irish actor, and he was speaking as part of this, they were talking about the Irish wake. And, you know, the singing, the dancing, the drink, so we have just made it so quiet and separate. And I mean, back to the kind of Facebook post, oh, sorry for your loss, press send.
Yeah.
Send flowers, the end, but cross the street if you see your grieving neighbor at the bus stop, kind of thing. We're just not comfortable. We're just not comfortable. Another really specific suggestion that we hear time and again people appreciate is to remember the dates. Because it's not just about the outpouring in the first few weeks. It's about 6 months later and when the child's birthday would have been. And if you know the date that someone died, just put it in your calendar. You cannot imagine how grateful 99% of people will be for you to reach out that day or a couple days before that next year. Dates can be just a very meaningful way to elongate your caring, right? It's not just about, did you help them take the garbage out for the first 2 weeks, or did you think of the right thing to say at the funeral? Just try to elongate that, and I think the dates is a really nice one.
Brian Hartzman posted a chat that one of the most isolating things about grief is that the griever ends up having to manage everyone else's grief or discomfort. And I think that's what's so brilliant about the grief coach and how you're describing, you know, cueing friends and family so that they can tangibly support the griever.
Right. I think
we don't know.
I mean, okay, well, just let me know how I can help. I'm sure what Brian is alluding to there is that the person is like, I mean, when my husband died, I didn't know how to tie my shoes. So someone saying to me, let me know what I can do to help. I mean, I don't know. I'm nowhere near in the position to be able to start managing what other people may or may not do, or how other people might or might not be feeling. There's a great book called There's No Good Card for This. And one of the things they say is play to your strengths. Do something that you can do easily and joyfully over time. If you're looking for a way to help, right? If you're good at organizing, then offer to help them get the bills paid or something. If you're good at gardening, do the gardening. If you love to cook, do the cooking. Find the thing that can be natural and free for you, and then just start doing it, as opposed to asking the person.
Yeah, which puts the burden on them, which, they don't know what they don't know. We have this interesting question from Beth Barnett. Can you talk about the situation of end of life in a nursing home? What are the most important things for family members to ask for about being with someone at end of life in a nursing home where visitation is possible at the end of life? And I'm sure that different people are dealing with clients and loved ones at this point where maybe they can, maybe they can't be with their loved one.
Yeah, there's some, hospices in this country date back to not that long ago, the 80s, when there were a few of them. Now I think we have about 4,500 of them. And they actually began as kind of a death doula. This week is actually a symposium with death doulas from around the world talking about end of life and how we can do better. And I think hospice bereavement managers are this, to me, just, it's so humbling to meet people who spend their all day, every day with grieving families at the end, that this is their work, and they are incredible people. And I think a lot of it is, I've come to think that, let's say everybody experiences exactly 100% grief. Like, let's say all griefs are equal for sake of argument. There is still a difference between how much of that grief happens before the last breath and how much happens after the last breath. So what happens during those final weeks matters a lot, because you're already grieving, but you're grieving with the person still there, where you can express yourself. Might be hard to do it, but you can, versus the sudden death where you couldn't be with the person and you get to now spend years wishing that you had the chance to say certain things. So I think that one of the wonderful things about hospice for people who have that opportunity is that you do receive bereavement care in advance of the death to help you be present, to be there and to be ready and to have the conversations. But of course, most people are not having that opportunity right now.
Aileen Gerhardt actually just posted a really good resource, it looks like, which is modernloss.com, and they have a resource. Their tagline is Candid Conversations About Grief, Beginners Welcome. That might be a good one. And
really
somebody
good stuff, and a good book as well called Modern
and Althea Halchuk just posted Speaking Grief.
That's the documentary I was talking about.
So that's posted in there, which is great.
That's one of the ones I was going to send out afterwards. This is a new documentary that's just come out. It's now available for free on YouTube. When I watched it the first time, I actually stopped what I was doing and watched it again a second time.
Wow.
The filmmakers, we actually so the filmmaker has given me clips that we actually now text out to people with. It's just so beautifully done. But it's not just about what the grieving person experiences. It is actually, Speaking Grief is about how we all need to, again, flex the muscle and be more comfortable speaking about grief, because for me, the intervention here is a human one, right? We're all gonna have to, as with everything, the answer is not simple, and we all need to dig deep and get a little bit better at something that's hard to do. And I think Speaking Grief does a really, really, really good job. The opening sequence is people out in their lives, but they're wearing a t-shirt that just says that they've lost someone, sister, child, and it shows people how we react. We step back, we're not sure, we're uncomfortable. And so the hour-long documentary takes us through what do grievers need from us, from the rest of us.
Interesting.
To reduce that stigma. And The also the website, I wrote it down, so I think it's speakinggrief.org. Aside from the film, it also has a ton of resources, clips from lots of different grief experts.
And we're going to get back to some grief questions, but I wanted to also put in there one for Dale, and I see that her video's on. So this is from Michael Wood. If you want to have an out-of-state relative visit you in Washington, what would be the safest procedure to follow? Have them quarantine for 14 days at home first, then test? And there have been a lot of things in the chat about how even though, even if you get tested, doesn't mean, that you're free of COVID. So can you comment on that?
Yeah. Yes, I would suggest that. I would suggest quarantine for 2 weeks. I think it's reasonable to get tested before they come. But if you're quarantining, you really are, we're not just saying isolating, we're saying quarantining, which means your food is there, you are not leaving and no one's coming in. That's what quarantining is. Then you should be quite safe depending on how they get here. So are they coming by plane or are they driving themselves? Are they, taking some other public transportation? I think fits into that risk. And then we each have to figure out independently if we're willing to take a small amount of risk or zero risk, in which case then probably you don't get your visitors in person, you get them on a Zoom or like with my family, we do weekly or every other week family game night on Sunday evenings, and we get competitive. So that's that's one of the things we're doing to stay safe. But yeah, nothing's perfect, but that's not a bad way to do it. And then they stay with you for 2 weeks before they head home or whatever. Canada has been doing that, and they've got an uptick in cases, but not as bad as what we have. So yeah, if you have a place to stay and you can guarantee you're going to stay there, that does seem to make a difference.
Very good.
Yeah.
Okay. So lots of people have been posting great resources in the chat. And so I just wanted everybody to know that we will be, and Emma is also going to be sending us some resources so that we can post that adjacent to this particular community conversation. And I also just wanted to briefly jump in and say, in the survey that we're sending, if you are a board certified patient advocate, this community conversation will count as 1 CE for free if you would like to take advantage of that. So I just wanted to let you know before we wrap up here. We still have a few minutes though, and so keep the questions coming. There's a lot of SemaCon posted a great blog about comfort in dump out ring theory. I don't know what that means, but
oh yeah, the ring theory is who you get to, let's say the grieving person's at the center of the ring, and then the immediate family, right, the spouse and the children, and out and out and out. And just as a good visual about remembering that people in need to be able to dump out, and the people out need to bring the comfort in. And so supporting the person who's supporting the person matters a lot.
Oh, I've never heard that.
That's cool. That's cool.
That is so interesting.
Supporting the supporters and so.
And is hospice support during this time, and we did a community conversation on this, but is this changing over time the longer we go with COVID?
Yeah, thanks for mentioning hospice again. I watched that community conversation. I thought it was excellent.
Thank you.
Hospices are right now doing an extraordinary amount of work, and they're extending their free grief support, not just to hospice families, but to anybody in their communities. So looking for if you're trying to find grief support for yourself or for someone who you care about, looking to your local hospice is a really good way to go, because everyone is all the grief organizations are so overwhelmed. But yeah, hospice bereavement managers it is shifting. They're Vitas, some of the big national or hospice organizations and others are, I just met last week with Christopher Kerr, who's with Hospice Buffalo. They're really trying to deliver more and more grief support to more and more people. So it is a really great place to look. And I think it's a place that people don't think to look. They think, well, if my dad wasn't in the hospice, then I wouldn't be eligible. But in many cases, they are trying to extend into their communities.
Oh, super interesting. And Dale, I'm kind of curious. I watched our governor of Washington State yesterday in his press conference as Washington shuts down more yesterday. And one of the things that I was really struck by was the ICU nurse, 20-year veteran nurse, who basically said, we all have to sacrifice right now because our hospital workers are kind of on the edge of their rope.
Yes.
So how are our hospital workers finding comfort in all the grief that they have and loss? I mean, you all are really experiencing an extraordinary amount of untimely death.
Right. And I think that group that are in the ICUs are particularly hit hard because that's where the sickest patients go. And fortunately, some of the treatment options are not perfect, but they're better. And so I think part of our death rates are a little bit lower because of just, using something like dexamethasone and the timing if you're going to use antiviral medications and so on. So we don't have anything that's a great treatment option yet. And there've been many things tried that haven't worked so well, but the fact that it's just not inevitable, I think, is helping. And most hospitals, to some degree or another, some better than others, have care for the caregiver, so that there are free resources to support them. But yeah, I think just the things that Emma's talking about, that it's okay to talk about it and that it's okay to cry about it. And that we need to reach out to our own support network to help us, whether that may be religious based or family based or friends or whatever. I think is the only thing that's going to get us by, because like I said, you do not want to risk having to be admitted for something else either, because that taxes the staff, it taxes the system, let alone you don't really need to be hospitalized, you need to be home. So I did want to add one thing when I mentioned testing with Michael's question. Get a PCR. Do not use the rapid test because there are too many false positives and negatives. PCR is a polymerase chain reaction, and that's the gold standard for testing. And the other thing that's starting to pop up is people are getting, when they go into some of the hospitals and clinics and other places that are doing testing, they're getting bills. So if you need a free test, then look to your county or your state clinics and sources for testing. Most counties have county-based ability, public health or otherwise, for you to go get free tests. And know that that test is not going to be available in, one day probably. But if you get, for instance, Michael's friend, if they're coming, or family, get tested 2-3 days in advance and make sure you have the result back before you come, or before you feel like you're safe to move on. So
it's really hard to get those tests. I mean,
it is.
I in prepping for the trip that we're now not going to take, we called around to a bunch of different places. So I guess one thing to know is and try to figure that out as soon as you can, because the slots fill up, and even with a paid test,
Right.
Yeah.
Right. And if you have a primary care provider, it's a good place to start. they'll tell you what their turnaround time is and all of that. But for asymptomatic testing, obviously the testing for those that are mildly symptomatic has to take precedence. And the more testing we do, the longer the turnaround. So it's that. We still don't have unlimited support that we need for this virus. Yeah.
Just
I did want to add before we're totally done, because you asked for the US data.
Yes.
On, I'm just a global citizen, what can I say? So yes, the US data is by December. So I'm going to compare the end of December with the end of February, basically, or March. The stats are a little bit different, but the current rate in the US of deaths of total is 318,000.
Projected,
yeah, based on our current rate, projected at the end of December would be 318,000 deaths. If we increase masking, we can reduce that by 17,000 deaths. This is in a short period of time.
I know,
right?
So many.
If we if we continue to ignore it, if we ease what we have, we increase it by about that same amount, about 17,000. Yeah. And for March, our current rate, the projected would be 437,000 deaths in the United States. With increased masking, we could save 68,000 lives. And with increased easing, we will lose almost 150,000 more lives.
Wow.
So it's,
grim.
it's super grim, and it's super hard because I know people are out of jobs and everybody wants the economy to get back to normal. And there are bits of the economy that can safely get back to normal, but it's not going to be these big gathering places for a long, long time, sadly.
I'm just looking.
Can I ask a question, Robin?
Yeah, absolutely.
Just real quick, and it's a little detailed, so I don't want to put it in the chat. But Emma, can you speak to? I helped a dear friend dying, and another friend, set up Caring Bridge, and the family just was not into it, and everyone else was, and it was really kind of awkward. So I had to kind of talk with them about, let's not use Caring Bridge right now. What they wanted was personal interaction with people.
Right.
So I'm just curious if you find those sites useful.
So I'm right now on about 4 or 5 Caring Bridge sites, and I hate them. I mean, I don't hate them. They have value, but they place a lot of onus on the grieving person, on the people in the middle of the whirlwind, right? So I'm on one. My friend had a stroke. Her husband is like doing these daily posts. It's exhausting and taxing, and very much a one-way communication, really, from the person in the middle to other people that do care and want updates. So we have a Washington entrepreneur, a woman by the name of Laura Malcolm, who started a company about 5 years ago called Give in Kind, giveinkind.com. I consider it to be
just posted on the chat.
Thank you.
Thanks, Vanessa.
I'm much more two-way, holistic, and easier to use, in my opinion, tool, because I think that you're exactly right, Beth. People want to help, but we aren't great yet at finding ways to help the helpers, to make it easier for those people who want to help to help. And that's, I think, what Give in Kind does. Caring Bridge, I mean, they've been around a long time, and it's beautiful what they were able to do in terms of building communities and communication. But they put so much onus on the grieving person. It's to Brian's earlier point. If you don't know what to do and you want to do something, Give in Kind is free, beautiful sites, and just a new way of supporting the supporters.
Yeah, we'll have to check that out. We'll have to check that out, and also include that in our resource list that we will post. And I just want to take a moment to say thank you so much, Emma, Thank you so much,
Mhm.
Dale, for joining us today and sharing your wisdom and your experience and helping us get through this hard time, because it is hard. And it's wonderful to see so many people in our community. We've had 60 plus people today participate. So we will continue to be hosting community conversations. Let us know who you want to hear from, what subjects you want to hear from, and we will continue to host these for free for our community. Thanks a million again, and everybody have a safe Thanksgiving too.
Thanks so much for having me, everybody. Thanks, Rob.
Yes, and thank you, Emma.
Of course.
Thanks, Robin.
Really great. Thanks. Bye, everybody.
Take care.
Take care. Yeah. Happy Thanksgiving.